Hi, my name is Melissa. I'm the nurse for today. The first thing I'm gonna do when I get to work, I'm gonna look at the patients that I have and look to see when they're gonna get medications. So today, my patient is Millie Larson. Her date of birth is 1/1/36. She has no known allergies. And today, the MAR says to administer metoclopramide, hepatitis B vaccine, metformin, and nitroglycerin. Okay. So I'm going to perform hand-eye hygiene. I got my hand sanitizer. I'm going to put on gloves. Going to go into the med cabinet. First medication, metoclopramide, 10 milligrams IV push. Metoclopramide, 10 milligrams, and 2 ml. So I'm going to draw up 2 milligrams. I'm going to get my supplies ready. To draw up, I will need a 2 ml syringe. So I have my syringe. I'm going to use a 3 ml. And a needle. To draw up the medication. Got my needle. Gonna do the 5 rates. Metoclopramide, 10 milligrams. I got the right medication, right dose, right patient, right route. Gonna open it up, clean it with the alcohol prep. Gonna open up my package. Two mLs. I'm going to draw back 2 mLs of air. Okay. Just put in there. I'm going to write medication, the dosage that's on it. $10 milligrams. Gonna put that off to the side for when I'm ready. Next medication, hepatitis B, intramuscular. Okay, I want to make sure I got the right patient. I'm also going to check the expiration date, make sure it's not expired. It's not expired. Right route, right dose, right time. Right patient, Millie Larson, hepatitis B vaccine, correct. For hepatitis infection. gonna get my supplies ready. I'm gonna get the other syringe ready. Hepatitis B vaccine, I'm going to give the whole dose because it's 1 dose vial, 1 ml. So I'm just going to drop 1 ml. Take the cap off. Clean it with an alcohol prep. One ml of air in it. Just drop the whole thing. Okay. Gonna get the air bubbles out. Gonna put a piece of tape on it. Hep B. Okay, gonna put that off to the side. Next one is metformin, 500 milligram tablet. Gonna get my medication out. This is, make sure it's right. 5 rights, right medication, right patient, right route, right dose, and right route. It's metformin, right medication is Millie Larson, right dose is 500 milligrams orally. Metformin, 500 milligrams. Take it orally. Okay. Gonna put it in a cup. Hard to get out. All sterile. Just gonna pour it in there. I'll keep that in there so I know it's that medication. All right, next one is nitroglycerin patch. 0.4 milligrams an hour. Transdermal application. Okay, I'm gonna get it out. All right, make sure it's the right medication. Nitroglycerin patch, nitroglycerin pack. 0.4 milligrams an hour, 0.4 milligrams an hour. Millie Larson. Right route. Okay, so I have the right medication. Now we are going to go see Millie Larson. I'm going to wash my hand before I go into the room. Maybe put some hand sanitizer on. I'm going to grab the supplies, go meet Millie. And we have Millie's hand right here. Arm right here. I'm going to introduce myself to Millie. Tell, hey, Millie, Mrs. Larson, I'm going to be your nurse for the day. Instruct her that I have some medications to give. And educate her on the medications I'm going to give. I'm going to tell her that the first one is going to be metoclopramide, and that's for her GERD, her heartburn. And check her that it will help her. Make sure she's not allergic to it. Okay, that's going to be the first one I'm going to give her. And I made sure none of these medications are expired. Okay, I'm going to administer this one IV push. So, and she has a lock right now. So I'm with the alcohol prep. I'm going to clean the site. Going to make sure that the IV site is still patent. Clean it again because I touched it. Okay. Okay, push. Make sure it's an easy push, no infiltration. Good, there's no infiltration. Okay. Do the 5 rights again. Right medication. Right. Look at the more. Right medication. Right dose. Right patient. Right route. Okay, clean it again before I administer it. Okay. All medications I'm going to give kind of slow, just to check for adverse reactions. Okay. Then I'm going to flush the remaining. Ask her how she's feeling, if she feels any better, or if she feels worse. Also, before I give her medications, I'm gonna get vital signs, so I know that her blood pressure is not too low, that none of the medications are gonna affect her blood pressure, her heart rate. Okay, just gonna flush it out. Documenting the more that I gave it. Okay, I can throw this out. Next medication, hepatitis B intramuscular. Okay. I'm going to pretend that this is her arm. This is the deltoid right here, the deltoid muscle. Hepatitis B. Gonna tell her I'm going to give her hepatitis B medication because it'll protect her from any hepatitis B infections. Make sure she's okay with it. Okay, this is a 22 gauge, about 1.5. It's going to go into the deltoid muscle. I'm going to make sure I have the 5 rights again. Right medication, right patient, right route, right dose, right time. Okay, I'm going to hold it taut, go straight in at a 90-degree angle. Go all the way in. Gonna push it slow. Take it out. Put that in the sharps container. Put a band-aid over it. Check for any adverse reactions. Next medication is metformin. This is gonna do the 5 rights. Right patient, right time, right dose, right route, and I'm forgetting another one. Okay. Next, all right, so I'm going to be giving the metformin. All right, this is shut off quick. I'll turn it back on, the MAR. Okay. All right, gonna instruct her, tell her I'm gonna give her the metformin. This is to control her blood sugar. Make sure I got the 5 rights. I'm gonna give her a glass of water with a straw. I'm gonna tell her to put the medication in her mouth and sip it and swallow. And then I'm gonna witness her swallow it so I know that she took it. Okay, so she took that. Check for any adverse reactions. Also, the other thing I would do that I forgot to mention, that when I walk into the room, I'm going to make sure that I have the right patient. So I'm going to clarify with her name and her date of birth. That's the right one. Right patient. Okay, next medication is nitroglycerin. I'm going to make sure I have the 5 rights. Right medication, right time, right dose, right route, right documentation. Gonna instruct her. Well, I'm gonna get her blood pressure, make sure that her blood pressure is not too low for me to give this to her. And if she has any other patches, I'm gonna remove them so we don't overdose her. So, gonna open it up wear gloves, open it up, instruct her, tell her how this might make her feel a little funny when she has it on her. Might make her feel a little headache. Okay, I'm wearing gloves. Okay. I'll take one side. Put that on her arm. Okay, I'm gonna write the time on it with a marker and when I gave it. Okay, I'm gonna check for any adverse reactions. After I'm done administering medications, I've documented everything in my MAR. I'm gonna make sure I sit the patient upright in the comfort position. Make sure she has a call light, so if she needs any assistance. And that's it.